Headache is one of the most common reasons people reach for a painkiller. Long day, bad sleep, or stress often lead to reaching for a headache tablet, and for some, this becomes almost daily. The dangerous part is that most people never stop to ask, what kind of headache is this? Or why does it keep coming back? They also don't consider if their own painkillers could be making it worse. In this episode, let's talk about headache and migraine, and how they connect to the medicines you use. I'm Ammar, a licensed pharmacist, and this is Medicine Wise. If you're tired of chasing your headache with random pills, hit subscribe and let's understand what's happening. Think of headaches in 3 simple groups: tension-type headache, migraine, and red flag headaches. Tension-type headaches are characterized by a dull, tight band feeling around the head, often linked to stress, posture, screen time, or poor sleep. Migraines involve throbbing or pulsating pain, often one-sided, and may come with nausea, sensitivity to light and sound, and sometimes visual changes. They can be triggered by hormones, certain foods, stress, or lack of sleep. Red flag headaches are sudden, severe, or accompanied by fever, stiff neck, confusion, weakness, speech problems, vision loss, or occur after an injury. These need urgent medical attention, not simple tablets. For tension and many migraine headaches, people usually use over-the-counter painkillers like paracetamol or ibuprofen. Used correctly and occasionally, they can be helpful, but trouble starts when they become an automatic daily habit. There is a condition called medication-overuse headache, also known as rebound headache. It happens when you use painkillers too often for too long, leading your body to create more headaches when the medicine wears off. This pulls you into a cycle of pain, pill, temporary relief, more pain, and more pills. While exact limits depend on the medicine, a simple rule is, if you are taking headache tablets most days of the week, especially for months, there is a real risk the medicine itself is now part of the problem. So your first smart question is not, which painkiller is strongest, but rather, why do I get so many headaches? For migraine, some people eventually need specific prescription medicines and a full treatment plan, not just random over-the-counter pills. Triggers can include certain foods or additives, lack of sleep or irregular sleep, bright lights, strong smells, hormonal changes, or stress. Keeping a headache diary, noting what you ate, how you slept, and what you did can help connect patterns instead of forever increasing the strength of tablets. So, how should you approach headache medicines wisely? Use painkillers short-term at the correct dose, not as a daily routine. Avoid mixing multiple different brands if they contain similar active ingredients. Don't combine heavy painkiller use with alcohol or other organ stresses. If you need tablets on most days, talk to a doctor about prevention, triggers, and deeper causes. Treat your neck, posture, hydration, sleep, and screen breaks as part of your headache treatment. And never ignore sudden, explosive headache, headache with fever and stiff neck, or headache with confusion, weakness, slurred speech, or vision changes. These are emergency alarms, not one more tablet and sleep. If this episode helped you think differently about your headaches and painkillers, subscribe to Medicine Wise by Ammar and continue watching this OTC series. For more clear medicine and nutrition tips, subscribe to Medicine Wise by Ammar. This is general education only. Always consult your own doctor or dietitian before changing your diet or medicines.